This car. Welcome to Plastic Surgery TNA. That's Talking Advice. Today's show is about curves and culture. This is where beauty, culture, and expertise come together. I am your host, Dr. Earl Stephenson Jr., board certified plastic surgeon in Atlanta for over 20 years. This episode is specifically for my African American sisters. If you're looking to enhance your curve safely and confidently, this episode is for you because we're going to talk about how culture influences decisions in plastic surgery. And you, as an African American woman, want to make sure that you are partnered with a plastic surgeon who understands your desires, addressing your unique needs, and that making sure that you have a voice in this process. So, welcome to Curves and Culture, body contouring for Black women by a Black plastic surgeon. So, first and foremost, let's get a little bit of business out of the way as we need to do each week that we do this podcast. The first thing I want you to do, if you're new, I want to welcome you. If you're returning, I want to thank you for coming back. It really helps if you guys could just do me a favor. If you can just subscribe to our channel, it will really help us grow. It'll allow me to be seen more on the algorithm, be able to reach and influence more people. Because what I want to do is spread truth and transformation. There are a lot of charlatans out there who will tell you anything, do anything to make a buck. I'm here to make sure that you're expertly advised and knowledgeable about the choices that you have within plastic surgery. So, subscribe to our channel. It really helps. If you want to keep up with episodes, I would ask you to hit the icon of the bell. That way, every time there's a new episode, you'll get a notification. So, with that bit of business out of the way, let's break down why culture and understanding of culture matters. Plastic surgery has been somewhat taboo, especially in the African American community. It's not something that Black folks do per se, because Black beauty has not been a cultural standard. It's been something that's been, for lack of a better term, minimized or demonized. Eurocentric standards of beauty have always been the case. So when you are considering plastic surgery as an African American woman, it is really hard to take that first step when one, your community is really downing that, and two, you may go to practitioners because there's such a paucity of African American surgeons, male or female. You don't really have a ton of choices, especially if you live in areas outside of large geographical uh, distributions. Washington, D.C., Atlanta, Georgia, New York City, those cities will have African American surgeons. But if you live in Des Moines, Iowa, if you live in Spokane, Washington, this might not be available to you. So this is why it's important. So we talked about European standards of beauty, and European standards of beauty have been really the ideal driven really by being considered the most attractive, the most desirable. And again, this often leads to devaluation of other cultural standards of beauty, especially again in the African American community. The European standard of beauty really emphasizes a couple of things. It emphasizes physical features such as obviously lighter skin. That goes without saying. It emphasizes larger eyes. It emphasizes a smaller nose, which is really a big stigmata or a big sticking point within the African American community. So, as plastic surgeons have been trained in history, most of the beauty standards have been taught based on European beauty. And so when someone who touts themselves as a rhinoplasty surgeon, they apply their surgical expertise based on results of European standards of beauty. And that just doesn't match African American culture and standards of beauty. These standards of beauty, again, have been mentally challenging for the African American woman. Uh, they've been looked at, they being African American women, as less desirable because they may have fuller lips. They may have a broader nose. Obviously, skin color, darker, and it's not seen as more attractive. But lo and behold, as we move forward, even in this very tense environment that we sit currently, beauty standards are widening and people's perspectives are changing. And so it's really necessary to appreciate or make sure that you have a plastic surgeon that understands where your beauty standards lie and not rubber stamp European standards upon what you desire. We really want to make sure that you are comfortable and safe. And I did a little bit of research on this, just reading articles, because innately I understand this. I have clients that come see me, they understand this. And we have these conversations in my office, but they're in a vacuum. And there are greater conversations, but these are the burdens, so to speak, that African American women are carrying with them. And as I was reading and doing research, I came across an article which was really good and had several kind of quotes or experiences from really various ethnic groups, uh, Chinese American, Latino American, African American, about how they felt shunned, ostracized, less than, because they didn't meet a certain European standard. And I really want to read this particular quote, which was really touching and really difficult to get past. And I really had to give that a lot of thought. So I'm going to put a picture of what African American or Afrocentric beauty should look like or may look like. And I'm going to read this quote. Quote, I suffer severely from insecurity and low confidence. I grew up with a mom hating her features. She always yearned for a small nose, a slim face, and she projected those ideals onto me. She still tells me, you look perfect with a small nose. It's all you need to fix. So she's had a nose job, she's had fillers, but she's thousands of dollars in debt. And I don't think she's ever been enough until she looks like a photoshopped poster. She buys whitening soaps, made me use hair lightening shampoo as a teen. I haven't exactly succumbed to Eurocentric beauty standards yet. I did save 3 years of my birthday money for a nose job when I was 16 until I got cold feet. But I always look in the mirror and I hate the bump on my nose and my prominent cheeks. I barely I could barely take selfies growing up, and I still can't stand my side profile. I don't know if I'll ever be happy with myself, but so far I've managed. This is heartbreaking that women are suffering like this. This is really difficult to hear, to listen to really digest. And I'm so happy that I'm here as an African American plastic surgeon for women who do decide that they do want to change a little something about them. And they can come to someone like me who understands that they don't want to look like a European. They want to be the best version of themselves. And because I am from their culture, their community, that they have a sense of at least initial safety, that I will understand where they want to go and how their results will impact them and impact the people around them. So it's really about representation from my standpoint, or anyone who understands the culture. And I'm not saying you just have to be black to understand the culture, but if you are a black plastic surgeon, you inherently understand the culture. I don't inherently understand uh, the Chinese American culture. I can learn, I can progress, I can develop, but I've not been immersed in that. I understand that. So representation within the specialty of plastic surgery is important. And there have been really great strides to have and train qualified individuals who are African American as plastic surgeons. When I first hit the city, there were probably about six black plastic surgeons. Now I'm sure there are over 20. And you say 20, that's really good. Atlanta's a big city, but that's really good. If you go to some other major cities, Dallas, Houston, Phoenix, you're not going to see 20 African American plastic surgeons. So the specialty is recognize that void, and they want to be inclusive, they want to be diverse, and they want to make sure that all cultural sensitivities are addressed. So, you know, training African American plastic surgeons is important. As an African American woman, you want to find someone who, again, is concerned about the quality of your care, who can understand that. And, doesn't have a potential for misunderstanding cultural needs. We've all seen or heard studies, reports talking about this disparities in care. And we're getting out of plastic surgery. We're talking about women's health, how mortality rates for women and children in minority communities is higher. We talked about disparities in treatment for breast cancer between minority communities and majority communities. So, unfortunately, this still exists. And so, again, not that a non-African American surgeon can't treat an African American patient, but again, cultural sensitivity is important, very important, because it feels good. And I'm just speaking from my experience. So it feels good when a woman comes to me and says, I came to you not only because I feel you're good, I like your work, you're well trained. I feel that you understand what I'm looking for. I've actually had women tell me, as an African American surgeon and an African American man, you understand how I want my body shaped because I'm interested in continuing to look good for my husband, my boyfriend. I'm interested in pursuing a relationship with a person, a man of color. You understand that. And so it feels good for me as a plastic surgeon and a plastic surgeon of color to be able to use my talents to help my sisters. So, with that being said, let's talk about the art of curve creation. Now, within the African American community, because women like curves, most of the most common procedures that African American women seem to pursue, at least in my experience and in my 20 years of practice, are breast reduction and lift, tummy tuck with waist contouring that can include liposuction, and fat grafting to the buttocks, or BBL. Those are those are procedures that African American women tend to gravitate toward because the culture accepts a hippie woman. They love curves, they love fullness of the butt, they love full breast, not huge breast, full breast and a tiny waist. And again, in my experience, and this is my experience only, in a Caucasian community or culture, typically a more athletic shape is what's desired, not so wide of a hip or wide hips, certainly not a big bottom, a big booty. I've had, you know, My white clients, women tell me, I would like a little fat grafting, just a little bit on my hips, but I do not want a big butt. That is not something that's culturally desirable in that community as a generality. In the Caucasian culture, women with like a larger, fuller breast, almost a little bit more than their waist, so they look a little top heavy. Again, these are just generalizations. In the African American community, they don't particularly want that type of look. There's no right or wrong answer here. Beauty has different standards to different people, different cultures. But my sisters typically like a curvy shape. Now, doing a little bit of research here again, found some things that were really interesting that really don't really to me jive with what I see 100% in my practice. There were some studies that have done with anatomy differences between African American and Caucasian women. And there's some key differences. The differences are in bone density, which I agree with, body fat distribution, and pelvic anatomy. African American women tend to have a little bit better bone density. I think that's been proven. At least I understand that, and I can see that, and I can the science works in my mind. Uh, Less prone to osteoporosis, less prone to fractures because of that. I think that's well studied. Body fat distribution. Caucasian women tend to have, according to the studies I show, more visceral fat. And what I mean by visceral fat is not fat that's underneath the skin, but fat that's around the organs internally, around your stomach, around your intestines. That may be true when you look at things globally. In my tiny piece of the universe, I've not really seen that. I really have seen in my piece of the universe that African American women have more visceral fat. I do believe, and I don't have the studies to back me on this, especially in the South, African American women tend to have a little bit higher rates of obesity. And in my practice, as an observation, I think that's true. Uh, in these in this research, I found African American tend to have women tend to have more subcutaneous fat. Well, that's fat that's just underneath the skin. Uh, and less visceral fat. And we talked a little bit about the visceral fat. I don't really see that in my practice, and I don't know that applies in my small world. But I do believe African American in my women in my small world do have a lot more subcutaneous fat. They have a lot more fat on their hips, a lot more fat on their tummy, typically, a lot more fat on their thighs. They have larger thighs or fuller thighs. So I think that's true. Uh, Pelvic anatomy was really something that was really shocking. Um, it stated in the studies I saw that Caucasian women have a wider pelvis, maybe bony pelvis. I really have to really get down through some peer-reviewed medical studies to show me the anatomic differences or just explain the anatomic differences. Uh, in my practice as an observation, I don't know if that holds true more so than not. And maybe it's because of the fat distribution. Maybe the bony pelvis in African American women is smaller, but there's more subcutaneous fat making the hips look larger. Again, I just think in my practice that African American women have a little bit larger hip, a little bit broader hip ratio, and tend to have a little smaller waist ratio, and that's what they want as a result. Where Caucasian women have a little narrower pelvis, and they have not as much fat subcutaneously, and they're a little bit more straight up and down. So again, I don't really see that as an observation that I can correlate on a broader scale. So when African American women see me, I understand that they want hips, they want curves, they want, you know, to be fuller because that's what's attractive in their cult in our culture. In Caucasian women, I don't see them requesting that so often. Again, I think the tide is shifting, and then I'm just sifting through my bag, and I'm trying to do this discreetly. I'm not going to just do this discreetly. I'm going to pull out my bag because what did I do? I forgot to plug my computer in, and my battery's going to die. So bear with me for a moment. This is why I need a doggone producer. Oh, no wonder my plug became unplugged. I actually was proactive, so apologize. This is why I do the podcast, and it's not perfect, and I'm okay with that. Now, hopefully, you're okay with that. So, we didn't have the threat. I just pick up stuff off the floor. We didn't have the threat of just losing the feed. So, all right, so we're back. Like I said, to summarize, in my practice, I don't see the observations of African American women having smaller pelvises. I think they have wider pelvises. I do think African American women have more fat distribution than Caucasian women, especially in their hips and thighs. I don't think African American women have less visceral fat than Caucasian women. I've seen it in the opposite manner in my practice. But be that as it may, that's where we are. And we understand that African American women want to preserve their curves and even want to really accentuate their curves. So here's some cases in point. Bring this up. Here's a woman pre-op for a tummy tuck. She actually has a few little curves. You can see her waist is a little narrow just below her rib cage, but not so wide hips, pretty straight at her hips. Hips are right into her leg. And she's going to want to obviously contour her tummy, but she's not going to want to really accentuate her hips, as opposed to this patient before surgery who wants a contour tummy, who has a little wider hip distribution, and doesn't want that touch. She doesn't want that straightened. She wants to keep that. She wants that waist to come down, and she wants to keep her fuller hips. So that's the difference. Sometimes in the distant past, this patient may come to a plastic or go to a plastic surgeon's office who may not have all the cultural sensitivities. It's an excellent surgeon, does excellent work, and the surgeon may recommend a tummy tuck liposuction and liposuctioning of her lateral outside thigh and hips and produce a straighter contour. Again, it's important as the patient to articulate what you want and what you don't want, but until you do so and until you have somebody who says, yes, I really understand and appreciate that potential result, you run that risk. So again, these two patients are as different as you can be. People are unique, and you have to understand and treat these people and treat people uniquely. You have to treat cultures uniquely. So again, they want different things. So this is her before and this is her after. We preserved her hips. I did not liposuction her hips. So we wanted to preserve that. She wants a narrow waist. So she's thrilled with this. Thrilled with this. And I didn't recommend liposuction of her hips. I could have. She had fat there to kind of narrow that, but she didn't want that. She wanted to be a full figured woman. As my mom would say, she wanted Coca-Cola bottle shape. So that's what she wanted. That's what she got. I can appreciate that beauty just as easily as I can appreciate my Caucasian patient who initially presented like this, wanted tummy tuck with liposuction, didn't want any addition to her hips. Some surgeons would say she's too straight. They don't particularly like that, but not here to project my wishes. I'm here to understand my client's wishes, and this is her result. Excuse me. straight up, not as broad, more athletic. She was thrilled. So again, I understand her cultural sensitivities, but it is not at the expense. Excuse me. Every time I do these podcasts, because I don't talk that much in general, I just get dry mouths. But nonetheless, I can appreciate that my African American sister wants to go here. I got that. I understand that. And you want to have a surgeon who understands that. But as a black man and a black plastic surgeon, I intimately understand that. Here is another case that I want to show you. Again, African American woman wants to preserve her hips, wants a little bit of fat on her hips to make herself a little broader, but wants her waist taken care of. So this is her before. And then what I did was a tummy tuck liposuction and a little fat grafting. And we've got a narrow waist and wider hips, more curvy, more Coca-Cola bottle shape. This is beautiful, just as someone who wants a more athletic look is beautiful. But I understood what she wanted. I appreciated what she wanted, and I delivered what she wanted. And that is the key. So it's really, really helpful when you're an African American plastic surgeon and you have an African American patient that you understand that they want fuller but not overly stated breasts. They want a really narrow waist. They like wider, fuller hips. And that is as beautiful as someone who doesn't. So, with that being said, that's well and good. We've done those procedures. We do those procedures. The recovery is the next stage for any patient, black, white, or indifferent. And there are nuances there. Healing matters. And the uniqueness of African American skin is of importance to understand as best as we all can understand healing as plastic surgeons. But as an African American surgeon, I again intimately understand because I suffer with keloids. I injured my finger and I have a bad keloid on it. I hyperpigment, just a little scratch will end up with a thin kind of scratch, but darkness around there. I have to understand that and anticipate that and speak to that when I'm speaking with my African American sister client and allay her fears that I just won't dismiss that or I won't give her good guidance. Because sometimes, if these issues are strong because they have strong family penetration or distribution, that I will say, here's the trade off. If you want the tummy tuck, we are going to have to accept some level of pigmentation, but I do I have treatments to help that. We can use, you know, hydroquinone. In my office at ESJ Aesthetics, I have a proprietary shade cream that helps people of color as the scar or healed incision continues to mature. Uh, if the scar becomes thick or out of proportion, we have, treatments for that. And I'm going to get into that in a minute. I understand that. I'm looking for that. I'm asking you these questions beforehand so one, we can determine if we should go forward. Because if you have a strong propensity for poor scarring, excuse me, in my opinion, sometimes we got to punt. Sometimes we just got to say we can't do it. Let me take a drink. We got to punt. We got to say it's maybe a little silly for us to do a really nice contouring procedure. And yes, if you get in an intimate moment and you take off your clothes, yes, you should have a nicely healed scar. Maybe it's even lightly pigmented, but you should not have large, wide scars. That's not aesthetic. And if that's where we're going to go, and it's really not much anyone can do for you because of your genetics, then maybe we shouldn't go there. Excuse me. That's, that's real talk. That's real talk from someone who understands that, so someone who, suffers from that as well. So healing matters. Hyperpigmentation, hypopigmentation, where you actually have decrease or loss of pigment. Handling the tissue or incisions as we are operating gingerly is important. Treating the tissue kindly, using techniques that support the tissue and the incision so that it doesn't spread or it's not under tension, so it doesn't create bad surface scars. That's a principle that I understand for all my clients, but it is paramount for my African American sisters or African American clients. Sometimes using stitches just below the surface that are removable as opposed to dissolvable, because the way stitches dissolve, they dissolve by a reaction, and a reaction at the skin surface or near the skin surface can certainly cause an unsightly scar or healed incision. Just those subtleties and technique are not lost on me. We want to ultimately prevent what I think are dreaded outcomes of healed incisions. That's a keloid and a hypertrophic scar. So, what's the difference? Keloids, I think, within our community, certain keloids are well known. When someone gets their ear pierced and they have an over excess of healing tissue and produces a contour deformity of the ear, people are in the African American community, and I think people generally at large understand that can be a keloid, and that is just an over exuberant healing response. It's usually something that's raised, it's firm, it's smooth, it can be uncomfortable, it can be itchy, and it can occur somewhat immediately or it can occur, years down the road. The the difference between that and a hypertrophic scar, which is a fancy word for a scar that just doesn't look good, is that hypertrophic scar is also kind of pinkish red. It's only slightly raised. It can be uncomfortable. It can be itchy. It usually occurs fairly readily within weeks, but it stays within the boundaries of the heel incision versus a keloid, which grows outside of that. And so, as a African American practitioner, I'm sensitive to that. I ask those questions. Do you have a personal history? Is there a family history? Do we want to proceed on with a contouring procedure, breast, body, or face, with that in play? If we do, what are our potential outcomes? How can we offset that? So these are really, really important conversations that need to be had, not in passing, but really drilling down and really making some hard decisions of, one, whether to proceed or not to proceed. And if so, how to minimize or mitigate this from happening, or once it happens, how to correct it, and knowing that. So again, I'm not saying that non-African American plastic surgeons don't have these conversations, but I believe, at least in my practice being a black plastic surgeon, I really am sensitive and try to nail this down so that we make sure that I give you the curves that you want without compromise. That is important. So, if you get a keloid or hypertrophic scar, how do you treat this? Well, an ounce of prevention is worth a pound of cure, as my mama would say. Now, you'll hear me quote my mom quite a bit. God her rest her soul. Silicone sheeting. So, I actually brought a prop. So, this is a silicone bandage or bandage. This happens to be in the shape of a breast inverted T or anchor scarf or a breast lift or breast reduction. This silicone sheet typically is applied to a healing incision so that it puts a little bit of pressure. It increases the hydration of the wound and makes it a little bit softer by retaining moisture and decreases the chance of formation of a keloid. I like to use strips sometimes. They come in different configurations, but I prefer gel because it's easier for my client. You just take a silicone gel, you apply it to the healing incision, you do that as directed, and it's really no fuss. These can be problematic because you have to kind of put them on. Sometimes you have to tape them on. Sometimes they have a little adhesive. They kind of get bunched up and underneath your clothes. And so it can be a little bit challenging with these types of silicone bandages. But I think silicone is great. And I definitely recommend that for anyone who's prone for keloid scarring to prevent that if we decide to move forward and there's a hint that you may be a keloid former. We want to do that. We also want to probably add some compression. Compression from a garment will give us just enough pressure to slightly decrease the circulation to the forming collagen so that it doesn't overdevelop. See, we want to combine those two therapies. The timing on that is really up to your surgeon. The body is incredible. Let's just say that it will do all kinds of things sometimes if you just let it. So, what I typically do after operating on my African American clients is I allow the body to do what it does for about 4 weeks. And at 4 weeks, if it looks like it's smooth sailing, then we keep observing. Doesn't mean we won't change course. We don't do anything. If at 4 weeks it looks like we got some, thickening, raising, the client saying it's really kind of itchy, it looks thick, then we're going to start to do some things such as this and compression. So those things are really important. It's really important to have that in your back pocket for your African American clients. What do you do once it's formed? Let's say you've seen somebody who wasn't your patient, but now they've got a keloid, or for some reason everything was smooth sailing for 4 weeks, 6 weeks, and 8 weeks, and then at 10 weeks, boom, there's a thick scar, that looks like a keloid. What do? You can certainly inject these with steroids. Steroids ramp down the formation of collagen so it softens and flattens the scar and reduces the inflammation. But also, steroids are not without their issues. Now, and they're not like steroids like bodybuilders take in that dose and that frequency, but it can locally at the area of injection cause thinning of the skin if injected too much or too often. That can cause hypopigmentation where you have a loss of pigmentation. So you have to use it judiciously. Again, every plastic surgeon has their way of doing things. I particularly use steroids as a trifecta. We got 3 times we can do it at minimally 6 weeks apart. And I try to, if I see something early that I can inject, then I will do that. And then I'll wait 6 weeks. And now I only got 2 more times to do it. So we really got to be more thoughtful when we give the next one. And if we give the next one, and we wait 6 weeks, now we only got one. I really got to hold that as my ace in the hole. So I'm really kind of methodical about that. Other practitioners may have other protocols, but steroid injections can be helpful once a keloid starts. If a keloid fails steroid injections, and I've done this occasionally, you can actually use a chemotherapy drug. It's called fluorouracil, and you can inject that just like you would into the keloid, just like you would steroids, and that will soften the collagen because chemotherapy ramps down inflammation, ramps down cell proliferation or cell building. And so it really will help that. My experience with fluorouracil has been, it's okay. It's not the end all and be all. I've either gotten people to respond to steroid injections or we had to go a different route. If you look at the literature always states that you can use cryotherapy or you can freeze it. Freezing will destroy it. It will just crystallize the cells and create a big inflammatory response, and the keloid would die back. But then this creates a wound, and a wound is an has a environment of inflammation, and I think you're just going to, in my opinion, create a larger keloid. And you can. Keloids are relentless. Once they kind of start, they like to stay and they like to grow. So I'm have never used cryotherapy. Let me just say that. And I just don't really follow the ultimate science of its use because it creates a wound that is more inflammatory, and to me, that can lead to more keloid formation. You can use radiation therapy. Yeah, the radiation, like you would think about for people who have cancer, but not to that level and not to that dose. It's local, right to the area of the keloid. It's superficial. And what that radiation does, it slows down the collagen or healing tissue formation. And I often use this in combination. This is for people or clients who have failed silicone bandages, compression therapy, and steroid injections. So what we do is we restart the healing process. I will remove that keloid, which is inflammatory. I will stitch it up in a manner that supports it beneath the incision beneath and at the surface underneath the skin with a stitch that doesn't cause a lot of inflammation, that is removable, and at that same time inject the freshly removed scar and closure with the steroids to start to minimize the healing response, not to knock it out, to get things to heal, but not to keep things from overhealing. And then we would have set you up in that particular scenario with a radiation oncologist. And I've done this quite often. It's worked nicely where we've done this and set this up all before. Once I perform that removal of the keloid and injection of steroid at the closure, we send you immediately over to the radiation oncologist's office, and he or she starts low dose radiation for the next 3 days to that area. So you've got the steroids, which will reduce the scar formation. You've got the radiation that will reduce the scar formation. We will then, on my end, have the patient back and see them over a series of weeks and make sure that we have silicone bandage therapy or gel therapy and compression. So we're using 4 or 5 components to minimize this. And it's still fighting a big battle because, again, keloids, once they form, they're really relentless. But again, this is what we do. We have this in our back pocket. I see clients all the time who've never had surgery with me, who've had an incident, who've had an ear piercing, who've had a tummy tuck, who've had a breast lift, and these issues have not been addressed. Now, there be many factors for that, but as an African American surgeon, as a Black plastic surgeon, I'm talking about this before we ever operate. We're thinking about this, and this is why it's important as an African American woman who is really interested in body contour touring to have these conversations. It's really, really important. You know, you've got to trust the process. This is why it's important for you as an African American potential client to work with probably an African American surgeon who understands your vision culturally, who understands the nuances of your recovery. It can really make the difference in a great experience and great outcome, or a not so great experience and not so great outcome. Again, I'm not here to say that non African American plastic surgeons can't do these things, aren't sensitive to these things, but I walk in this skin every day just like you walk in this skin. There's certain things that are just inherent that I think of that never crossed the mind of people who do not look like me. And it's not a knock, it's just everybody has a different life experience. And you want to take that in consideration when you, as a client, would be interested in plastic surgery. So, you know, we're near the end of our podcast, and I think the thing is there are a couple of points. We're living a new day and age. I think beauty standards are expanding. The stark divisions between black, white, etc., are those lines are getting blurred. They're interracial couples producing uh, children of mixed heritage and culture, and mixed ethnicities. The standards of beauty that were once pretty tight, and basically white European standards, those lines are being blurred. And people are really seeing that beauty can come in all forms and can appreciate that. What I want for you as a potential client is to understand that you are beautiful no matter where you come from. You are beautiful. Beauty is in the eye of the beholder. Go to someone who sees your beauty, who understands your beauty, and won't judge you or try to assimilate to a different standard of beauty. Beauty isn't a one size fits all. Uh, Achieving your curves uh, is as unique as you are. So, if you're considering body contouring, find a plastic surgeon who understands your desires, your healing process, and most importantly, your culture. And I think hopefully I've hammered that home. If you're ready to take that step with someone who really gets it, then I'm your guy. I'm your guy. All you have to do is to start the conversation is something super, super simple. You can pick up the phone. You can give me a call at my office. Our office number is 770-466-4700. We'll be happy to schedule an appointment consultation for you. Our consultations usually last a minimum of an hour. It is a $225 charge. And if you decide to work with me or we decide to work together and move forward, that charge, that $225, will come off your final quote. That's the easiest way. If you want to check me out a little bit more, you've got a couple of places to do that. We have a YouTube channel that hosts this podcast. Here's the link right here. Check me out. I've got over 250 videos of various sorts. So see if you get a feel for me, see if you like me, see if you like my style. Then we can pick up and have a conversation. You can pick up the phone and call. You can go to my Facebook page, and there's the link there. Same type of deal. You can check me out without really engaging and then decide to make the call. If you have questions, you don't really want to talk on the phone, you can always email my team. It's ESJ Aesthetic Team and it's at this email address, concierge at ESJ Aesthetics. We'd be happy to answer any questions that you have. And we will encourage you to make a consultation so that we can address your uniqueness and we can develop a plan that's solely for you. So, on that note, last thing I want to say, if you've enjoyed this video, again, please like and subscribe. I don't want to forget, and I almost did forget. Let me pop this up. I made a guide for my African American sisters. You know, it's really to help you navigate body contouring from A to Z. So if you're interested in this freebie, all you have to do is click the link in the show notes below. It'll give you everything you need to know to start your process. And again, if you like it and you want to work with me, I encourage you to call our office and I would love to meet you. So until next time, stay beautiful, stay empowered, and peace. Have a great weekend wherever you are in the world. Peace.